All right, and welcome. We'll go ahead and get started. As I said, this is Boulder County Senior Law Day 2021, and we are here for protecting your Medicare number, Medicare fraud, and identifying scams. We have a few housekeeping matters to get started on before we begin today's presentation. Today is a webinar, obviously, because we are in a webinar, but our video will be recorded and available later on the Boulder County Senior Law Day website. We are having some technical difficulties with that, so please be patient, but within a period of time that will be uploaded and ready to view, and we are really excited for that. We have muted all participants. Please remain on mute unless the speaker invites you to unmute. We are going to do questions at the end of the presentation today, and you can type those questions. There is the regular chat box, and then there's also a Q&A box. So please feel free to type your question as you think of it, and know that we will address it at the end of the webinar today. I also want to remind you we have some upcoming webinars every Tuesday and Thursday until October 7th. This Thursday, I am really excited for this one. This is going to be our district attorney, Michael Doherty, talking about elder abuse. It is going to be a really interesting talk about the state of our criminal justice system and how to address elder abuse in our community. Next Tuesday, we have coming up a talk from Jorgensen, Brownell, and Pepin, which is a law firm on fiduciary duties, which is, I've been to this presentation a few times and it is really fascinating and will tell you all sorts of things that you never knew you needed to know, but you really do need to know. So to sign up for those, go to our website, bouldercountyseniorlawday.org. I will be posting that in the chat later. We are also really excited. We are able to add an in-person element to this year's event with our Ask a Lawyer. This is a free legal clinic. So you drop in, you don't need an appointment, and you get a free consultation with an attorney. We have the event in Boulder coming up this Saturday, September 25th from 9 to noon. It's at the Boulder Age Well Center at 909 Arapahoe, right behind the library, if you know where that is. Masks are required. It will be, again, a really good opportunity to get a free consultation with an attorney. And we have attorneys with many different practice areas. It will be really fascinating. If you are unable to make it this Saturday, our platinum level sponsor, the Boulder County Bar Association, has been running a free legal clinic as well. This is a virtual clinic though. Callers can sign up by calling the Bar Association or applying online. I will be putting that link in the chat as well for folks to come sign up for the virtual free legal clinic. Senior Law Day Handbooks. We do have these available. They are mostly available online, or you can scan the QR code just like you would a menu at a restaurant. And you can get the link directly by holding your phone up to whatever screen you're watching this on to access that. I'll also put the regular link in the chat if that's an easier way to access. We will be passing out a few copies at the Ask a Lawyer event on Saturday, though. So if you really want a hard copy, come to Ask a Lawyer on Saturday. Finally, we want to thank our sponsors. We cannot provide these events without them. We have the Boulder County Bar Association, Pearl Fiduciary Services, and Fraser as our platinum level sponsors, giving us the most help. For gold sponsors, we have Jorgensen, Brownell, and Pepin. Silver sponsors are Hofgaard Law and Bach Financial. And our bronze sponsors are Kingsbury, Johnson & Love, LLC, and Friends of Longmont Senior Services. And with that, I am really excited to present our speaker for Protecting Your Medicare Number, Teresa DeAnni, with Healthy Aging Programs Manager with the county. Teresa has over 25 years of experience working in services for older adults. And as the Healthy Aging Programs Manager, she manages Medicare Counseling Program and Nutrition and Wellness Services for Boulder County Area Agency on Aging. I cannot tell you how hardworking this agency is and how critical the work Teresa does as a part of it. So I am so excited to pass the presentation over to her and learn from her experience. Thank you so much.
Thank you. All right, we'll get started soon. Okay. Okay, well, welcome everybody. We're going to talk about healthcare fraud and abuse, a fun topic. This is brought to you by Boulder County Area Agency on Aging under the Medicare Counseling program. Medicare Counseling does Medicare Basics classes, helps consumers with their Medicare questions, with one-on-one counseling sessions. And coming up is the open enrollment period, October 15th to December 7th, where beneficiaries can change their prescription drug plan or change their Medicare Advantage plan. So we're setting up appointments for that soon, so I can give you information on that later on. Okay. So what is SMP? SMP stands for Senior Medicare Patrol. It's just a name they've given the CMS, the Center for Medicare and Medicaid Services, to help put a grassroots bent on getting information out to the public and also to oversee possible Medicare fraud and scams. There's a lot of fraud and errors and abuse that go on. And so we are empowered to assist you or Medicare beneficiaries, families, and caregivers to help prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. So Medicare fraud, errors, and abuse affect everyone. It's a lot of money that we lose to improper claims. And every time you hear about the Medicare trust becoming insolvent, it's due to a lot of misuse of the funds, and a lot of it's done with Medicare fraud and abuse. So what it means for Medicare beneficiaries is higher premiums, less money for your needed benefits, and your quality of treatment. So it's kind of like just siphoning off the money over there, a little cartoon. You can unmute if you want. Can anybody tell me how many billions of dollars we lose with Medicare? Okay. We lose about $60 billion in Medicare. And that's a lot of money to lose every year. And that's probably an underestimate about what actually happens. So there are consequences to this: Medicare fraud, errors, and abuse, medical identity theft. There's a health impact to this, and it's also personal and financial losses. So what are we talking about when we're talking about Medicare fraud? That's the intentional billing of Medicare for services that were not received or billed for service at a higher rate than is actually justified. That's really called upcoding. So it's pretty common. That's what happens in fraud, is that people will just create a more severe diagnosis for someone, or provide the billing for a service that's more expensive than what really is justified. Medicare errors that happen all the time. It's a human mistake. There's a lot of codes. It's very complicated. It's very common for providers to accidentally enter the wrong name or information. So if the error is a human error and not fraud, we often work with the provider to rectify the error. Medicare abuse is when providers supply services or products that are not medically necessary or that do not meet professional standards. So some of that might be a knee brace that maybe people don't really need, that's being sold or that's being offered, or maybe even lab tests or x-rays that aren't medically necessary as well. Examples of fraud and abuse or billing for services, supplies, and equipment that were not provided. If you pay attention, in the last couple of years, there were some articles in the Daily Camera and the Long Times Call about Medicare fraud. Basically, a therapist was caught billing for services or sessions that they did not provide. And that's only caught by the recipient looking at their Medicare summary notices and noticing that something's not right on this, and then calling us, and we can help with that, or even calling the office of the Inspector General directly, or calling Medicare. A lot of times people bill for excessive medical supplies, things that people don't really need. A lot of times there's obtaining or giving a Medicare number for free services. This happens a lot, and it's happening a lot lately. The people are getting called and being asked to give their number for their Medicare number for free services, whether it be a test, a genetic test, or a knee brace or back brace, or anything that they can sell the Medicare beneficiary for free. But they do that by getting your Medicare number. And so we often just tell people, don't give out your Medicare number to anyone that you don't know. Give your Medicare number to your doctor, your healthcare provider, to us when you are getting counseling services. But trust me, when Medicare is not going to call you to ask for your number, because Medicare already has your number, and it doesn't work that way. People don't get called and get the Medicare number to get services. There's a lot of improper coding to obtain a higher payment, and that happens quite a bit. Unneeded or excessive x-rays and lab tests, claims for services that aren't medically necessary, and then using another person's Medicare number or letting someone else use yours. So those are examples of fraud and abuse. And preventing fraud in Medicare health and drug plans, because it's like the open enrollment period, lots of things are happening. Lots of people are getting phone calls, lots of mail getting sent. People might even be getting people knocking on the door and talking to people about a Part D plan or Medicare Advantage plan. There are guidelines that CMS gives to these entities, and they can't do these things. They can't send unwanted emails without an opt-out function. They can't visit you uninvited. They can't call or text you, non-members, unless given permission. They can't offer cash to join their plan. They can't give free meals at these marketing events. And they can't talk about their plan in areas like hospital patient rooms, treatment areas, and pharmacy counters. Now, a lot of these sales and marketing events will have something like a sign-up sheet for you to sign in. And when you do that, when you sign up, you're essentially giving them permission to call you. So you have to be careful of where you sign up and give your information. So there's some real life cases of fraud and abuse in Boulder County. A resident contacted us because she started receiving back braces after a phone call. The caller identified as a telehealth call, and the caller happened to know a little bit about her, so she thought that this was a legitimate call. So that we found that she had been shipped back braces 3 times, and Medicare was billed over $8,000. And the case went to the Office of Inspector General for follow-up. Recently, a resident reported a caller had told her that if she didn't have cancer tests now, Medicare would never cover cancer treatment in the future, which is a ridiculous statement, and it's totally untrue. And Medicare doesn't threaten. And so anytime you get a call or somebody knocks on the door or asks you for any of these things, you can always call us. You can always send us an email, and we can follow up with that. Also, genetic testing was big. I'm not sure if it's big these days, but somebody gave, or the resident gave her a Medicare number to a company offering genetic testing, and Medicare doesn't pay for that unless under very rare circumstances. So it's just important to never do this over the phone. It's always about you and your healthcare provider making decisions and getting the care that you needed and the testing that you need. So there's a whole bunch of unemployment scams and extra benefits and fraud. A lot of back braces and knee braces are big. The cancer screening is big. The COVID vaccination scams happened a lot in the last 2 years. So what we recommend is the 4 hours for fighting Medicare fraud. Record your appointments and services, so you can look against your Medicare summary notice and know when you saw your doctor and received the service. Review your services provided. Really look at it. Sometimes there's an error, sometimes it's wrong, and that you would call the healthcare provider and have them fix it. If you suspect it's fraud, then you would call us or you would call Medicare. And remember to protect your personal information like your Medicare and Social Security number. And keep track of what you're doing. A friend of mine has a separate credit card just for medical expenses. So she has a nice tally of all the co-pays and the services that she's paid for. She's partially paid for on her credit card account. So it's easy to kind of look at and just check and see against the Medicare summary notice to what's being charged. Then you also could create a secure personal account to access your Medicare information anytime. You can go to medicare.gov and you can create an account in mymedicare.gov, and you have an account and you can print your Medicare card, you can access your electronic health information, you can pay your premiums, and you can view your claims as soon as they're processed, as well as find plans in your area. And then you should contact your local SMP, that's us. You can visit us online at bouldercountymedicarehelp.org or call us at 303-441-1546. Email us at Medicare Counseling at bouldercounty.org. Just to report suspected fraud and abuse, or just to get some information, publications, a talk to your group. And what we do is we'll help protect and detect and report. So what we do is if you call us, we'll take that information, we'll document it, and then we'll report it up to the CDORA ship that oversees us in the state. And they have a specific person who deals with Medicare fraud cases. So that person will then take that information and assess and see if it is fraud or if it's abuse or it's just an error. We also provide one-on-one counseling regarding that. And as I said, we perform preliminary work on cases. So that's kind of about it. It's a pretty short program. Does anybody have any questions? I'm not sure if I see any.
Yeah, I don't see any questions right now in the Q&A or the chat, so I'm just going to invite people to jump in there. But I actually had some questions that came up because obviously this is a very serious and important issue. I'm curious, do cases typically arise out of, because you mentioned the step would be to refer to the OIG. Before that, do cases usually arise from someone contacting your office to let you know that they noticed something weird, or does your office have the authority to do any investigation, or does law enforcement do that?
Yeah, they would contact us. We don't have the authority to investigate. We will document it and then send it up to the CDORA office that oversees the SMP grant program, basically. And then they will do the investigation and see if it warrants going to the OIG.
Okay.
Yeah.
Great. And we do have a good question that came into the chat. A pharmacy wanted to know my Medicare number. Is that okay?
Well, yeah, because they need your Medicare number for probably your prescription drug plan, if that's what it is. You might want to call us and just talk to us about that. But if they're wanting your email Medicare number to help pay for your prescription drug plan, or they're asking for your prescription drug card, or they might want to help you find a prescription drug plan that is better for you during this time period. Some of the pharmacies do that. We'll help you do that if you want, and with our open enrollment counseling sessions, we can do that one-on-one with you as well. It just really depends on what it's for, but if it's probably for a prescription drug plan, they do need to see your card.
Yeah, and the question asker says, thank you, Teresa. As kind of a follow-up to that too, so I'm just personally through family members who participate, familiar with the Silver Sneakers program.
Yeah.
Is that something where the Medicare number would legitimately be asked for, or is it just actual medical providers? Sorry, I can't speak today.
That would be those are part of like Medicare Advantage plan.
Okay.
So those are particular plans, and like Silver Sneakers is part of that plan, and so it should be not really the Medicare number per se, but probably the plan's number.
Okay. Well, it's an important distinction to understand too.
Yeah.
Because I think as we learned earlier in this webinar series from the Community Protection Unit, people who are out to scam folks can get really creative.
They get really creative, yeah, and they get really clever. There's just been a lot of it's getting more and more aggressive. I think every year it gets more and more aggressive and unscrupulous as well. I mean, people are being signed up for plans that are not at all appropriate. And sometimes there's no way to get to unwind that,
Mm-hmm.
So it's really has some really bad situations that people are experiencing more and more these days, I think, and especially during this time. I mean, people get paid a fee for signing up people, so they don't really care. Most of them don't really care what happens after they sign people up. So it's always a good plan to just call us, email us, set up an appointment with us, just to see if what you're being told is correct, and just to see if there are better plans or there's just more correct information to give you.
Yeah, and you mentioned the counseling program.
Mm-hmm.
Can you talk a little bit more about that and what that program does?
Yeah. Well, we do Medicare Basics classes, usually about 3 times a month. So we provide the overview of Medicare, going through A, B, C, and D, and talking about the different plans. And then we also provide one-on-one individual attention to beneficiaries or new beneficiaries or pre-beneficiaries to go over their information, to go over what their needs are, how much they're willing to spend, how much they want what kind of coverage they want, so we can provide them with a little bit more individual guidance as to the different plans that are better for their situation. And we don't get any we don't get paid for anything. We're not biased at all. It's really very neutral, very fact-based, and it's very trustworthy.
Yeah, so if anyone has any questions, this sounds like a wonderful tool to prevent some of these frauds from happening. That this program should be the go-to rather than.
It's always good to call the 303-441-1546. Just call us. We'd love to just find out from you before you make any decisions at all. And I think one of the main things is to I feel like I've missed out on some things here. I feel like I'm missing
What was that number again? It was 303-441.
303-441-1546.
Okay, I'll go ahead and put that in the chat. And we do have a couple more questions that have come in.
Okay.
Yeah. How do I efficiently sift through the different plans? What is the name of the program you are now talking about and how to reach them, please?
It's the Boulder County Medicare Counseling Program, and it's, if you call us at 303-441-1546. Let me see. Let me go here. And you go to, we have our website, bouldercountymedicarehelp.org, and the email is medicarecounseling@bouldercounty.org. It's really challenging to sift through all the information. And if you're in your mid 60s, you're probably getting like this avalanche of mailings and even phone calls. And of course, you know, if you're watching TV, the ads are really misleading. I mean, they're really very good and they're misleading. And sometimes they'll even say it's like a certified Boulder, like a Medicare counseling or whatever. The only certified Medicare counselors are the ones in this SHIP. It's a SHIP program, the State Health Insurance Assistance Program. And we are SHIP counselors. So that means we're certified. We get trained by CDORA, the entity that oversees us. So we have a lot of training. We have a lot of oversight, and we have a lot of the expertise and the experience to kind of help people work through the maze. And I think the Medicare Basics class that we provide help kind of provide a good foundation for people, because sometimes you don't even know what questions to ask. Sometimes you don't even know what you don't know. So if you get a sense of the different parts of Medicare and how that all works, then you can actually sit down with us and probably have a better conversation about what your needs are. But I just recycle everything except the things that say CMS and Boulder County, and also if you are already receiving Medicare and prescription drug, just look at your plans documents that are sent. Legally, they need to send documentation around this time of the year if they're going to be changing their plans. A lot of times with the prescription drug plan, which is Part D, they will change their formulary or the drugs that they cover every year. They are legally required to notify you with the documentation, but you'll get a thick documentation. It might be hard to go through. Might be hard to find all the information, but just give us a call and we'll help you figure out if anything's changed. And if also, a lot of people do save money by finding a new, better plan. So it's more often than not that happens. So it's always good to look, and it's always good to just call us just if you suspect anything, if you're worried about something. But in general, don't give information out over the phone.
Yeah. What are the hours for that office?
Usually 8:30 to 4:30, Monday through Friday.
Okay, great. And we have a really nice comment here. Sounds great. Just what I was looking for and did not know you existed.
Great. Well, let us know how we can tell other people how we exist, because it's challenging.
Yeah. We have another question that came up in the chat.
Mhm.
I'm going to be 65 next week. I will not be having an Advantage plan, but I am interested in a Silver Sneakers program at some point. Do they usually ask for a Medicare number?
Well, the Silver Sneakers is part of a healthcare plan, and it's usually a Medicare Advantage plan that has those. So you would have to be signing up for a Medicare Advantage plan. There are some other plans called supplement plans that you would get with original Medicare that might have Silver Sneakers, but for the most part, they don't offer those. But it's best if you're turning 65, you should call us so you can get signed up for Medicare, because you have a bit of a small window to sign up if you're not working. So please call us to get a counseling session so you can make sure that you're getting the coverage that you need to have at the time you need to have it, because otherwise you'll get some financial penalties if you don't sign up. So yeah, the silver sneakers is a big draw for a lot of people. It is. It's huge.
Yeah.
And the thing is, if you give out your Medicare number, there's a thing called medical identity theft, and it's kind of like it can really result in really bad news for you, because if you get your medical identity theft stolen, or if somebody has your Medicare number and is using it, it could result in a lot of different things, like treatment for conditions you don't have, bills for services you don't get. You might be denied services or prescriptions, and you'll have an inaccurate medical record. There's I don't know if this still goes on, but there used to be like this entity that did a lot of screenings, a lot of kind of scan screenings. They would ask, I think you would give them your Medicare number, but what happens is that they then will bill Medicare your wellness visit under the wellness visit code. So if you go to the scanning place and you give your number, they're going to be billing for the wellness session, basically, that you're allowed with Medicare once a year. And if you go to your doctor to get that wellness session, you're going to have to pay for it out of pocket or not get it at all, because that's already been kind of used up already. So they will, these entities will try anything to try to get your number. They will cajole, they will charm, they might even sound legitimate. And I think everybody just needs to be more aware, because every so often we do get some reports about Medicare becoming insolvent. But if we just band together and try to save, because it's more than probably $60 billion that we're losing every year to this, and there's a lot of fraud that's going on, and it's just intricate. It's just laboratory services working with doctors, and then they also own kind of a telemarketing group that'll try to get people to sign up for things. It's all very insidious and connected, and it's best just not to answer the phone.
So we have another question. Is there a site from which we can download or print your slides, or is the presentation on YouTube? So I can actually answer that. Teresa, I believe you emailed me your slides before today's presentation. So anyone can email info@bocoseniorlawday.org to request a PDF of the slides. And I'll put that in the answer to that question. And
any other questions?
Yeah, and I'm also putting that email in the chat for folks. And we will be uploading this to our YouTube channel. Usually just wait a couple of weeks and it'll magically show up on there. We're about halfway through all of our presentations. I think you might be the actual midway point. But those will all be uploaded to the YouTube channel. So just give us a couple weeks and it'll be magically there for all of you on the YouTube. Do we have any other questions for our speaker today? I know we've had a really, really good, healthy question and answer session today. So I always appreciate that. I am going to go ahead and post the YouTube channel in the chat as well, because that will be a nice, easy way to access things in a couple of weeks. You can access all of last year's presentations on there.
Oh, that's great.
Yeah.
Okay.
So, well, we're finishing up a little earlier than usual, but so one last call for questions. You can have the question that takes 20 minutes to answer if you really want.
I'll try to do my best to do that. Yeah.
I just want to thank you again. This was absolutely fascinating. It's you know, so strange to think that there is a problem this big that doesn't get more publicity out there in the world, that this much costs to the taxpayer, to the government, to the individuals who are targeted with these scams.
Yeah.
It is just wild to think how far reaching this problem is. So thank you.
Okay.
And I think we do have one other question. I'm going to answer it live, but I will also post in the chat. Our Ask a Lawyer session is going to be this Saturday, the 25th, at the Boulder Senior Center, or the Boulder Age Well Center, as it is now called, from 9 to noon for a free consult. And I'm just gonna, and it's called Ask a Lawyer. But yeah, show up right at 9 o'clock. You'll be the first one in line to get your questions answered. We are going to have some estate planning attorneys. We are going to have consumer attorneys, housing attorneys, I believe some family law attorneys attending, just a wide variety of types of cases that people can get help on this weekend. So please, please, please join us for that. And we hope it's very helpful. We do have another question. If I believe that my provider is billing for small services I didn't get, who should I call? And this person was just a little late logging in.
Why don't you call us and we can help walk you through that, and then we can document it and send it upward to the person that deals with it.
Is there a phone number that's a good number for people to call?
Yeah, it's the 303-441-1546.
Great, because yeah, I can just, and then wonderful service, especially for seniors. How often is that done? Oh, the Ask a Lawyer session. So I can answer that one too. We have had two Ask a Lawyers connected with Senior Law Day. Typically it's only one, but we figured it had been a while. We wanted to do one in Longmont, which was on September 11th, and then one coming up this weekend. Before the pandemic, before March of 2020, there was one of these free legal clinics once a month throughout Boulder County. Unfortunately, right now, it's just not feasible to do that. The Boulder County Bar Association, as a replacement, set up the virtual legal clinic, and that was one of the very early things that they did to try to help avoid having people go without any sort of advice. But the in-person is always a little easier to understand. You can bring documents with you. It's a little. I think sometimes you get a little bit more human connection in person than over the phone or over Zoom, but both are really good options. I will say the virtual clinic gives you the opportunity to kind of schedule at your own pace. But we're hopeful that in our community we'll be able to do these free legal clinics once a month again at some point in the future. We're really hoping for that. But in the meantime, September 25th is the one to go to if you want an in-person clinic. Well, great. Well, if we don't have any other questions, we will go ahead and wrap up just a little bit early. Teresa, again, thank you so much for everything. And yeah, I highly encourage everyone on this call to join us on Thursday for District Attorney Michael Doherty's talk about elder abuse. A lot of these scams do target seniors, and I think it's very interconnected, the way that elder abuse can be effectuated, and these scams and frauds that exist out there. So please join us. And
Yeah, there are other scams that are not related to Medicare that his office deals with. And I think they give presentations too. I think Desiree Fairley gives that those presentations.
Yeah, absolutely. And I'm just going to type just the link for.
So how many lawyers are at the Ask a Lawyer session?
I think we've got a good chunk of volunteers. I want to say we've got about 10 volunteering each session.
That's great.
So please, yeah, please join us for that. Michael Doherty is speaking this Thursday from noon to 1 during the same time slot as, so it'd be Thursday, the 23rd. And I'm posting the link to his talk in here. For everyone who's saying thank you, you are very welcome. I'll also post the link in the chat so people can access that. So if you have already signed up for it, you should get a reminder email. If you have not, please go to our website to sign up, or the link that I just posted will take you right to the registration for Michael Doherty's talk. And I'm expecting a good one. He's always extremely informative and really interesting to talk to, and has the latest information. Yeah, well, and thank you to everyone for joining us, and we'll wish you a really good afternoon and a safe weekend, and hopefully we'll see some of you on Thursday and this weekend. Take care.
Bye-bye.